welcome to my YouTube channel. On this channel I talk about everything nursing, especially to the UK, motherhood, lifestyle, and every good stuff and everything in between. So if you like any of those things or you're interested in nursing and especially in the UK, then please subscribe down below and hit the notification button to get any updates on any new videos I post subsequently. Today we're going to be talking about the differences between the NHS and the care home. So let's get right into it. Firstly, NHS, which stands for the National Health Service, is the main provider of healthcare in the UK. It is the main employer for health professionals in the UK. It is the single largest employer of health in the UK. Okay, so we have other various bodies that give healthcare services in the UK, other than the NHS. We have private care services, that private companies that come together as limited liability companies and offer health services in the form of private hospitals in different areas in the UK. However, the NHS is so broad, it covers the whole of England. You have the NHS England, the NHS Scotland, and these are all independent to themselves. In Northern Ireland, you have the NHS. So the NHS is a very vast service providing all forms of care, and it's very interwoven and very well thought out. In this I mean from the primary healthcare up onto the tertiary centers, up to the teaching hospitals, it's all well thought out and linked together. So first you have the GPs, who are the primary care providers in your local community. So in any given local community where you are or town, you have GPs, which is a short form of general practice. Here you have doctors, who can call them consultants if you may, because it's a area of specialty. So these doctors are the ones who take charge of these GP surgeries or GP practice, depending. And here local people will go on to get themselves registered. So you have to be registered in the GP to be able to access healthcare in the UK. You get registered in the GP. Now this GP is a form of practice where people come in, lay their complaints, their primary complaints. That's your first stop. You go to your GP. First off, you have the pharmacies. The pharmacies you can go to and complain about things, and they can give you over-the-counter remedies, but they cannot prescribe these drugs for you. If you need prescription drugs, you need to go to your GP. So you can go to your pharmacist for little things, and if you're not getting the help you need, or you're not getting better, just like you take your paracetamol 3 days and you're not feeling better, you go to GP. And it's mostly by appointment basis, so you have to call in. And because we know it covers a whole lot of people, it may be difficult to get appointments to see the doctor. However, you have to keep trying. Priorities are given to children and to pregnant women. This is what I've noticed, and which is understandable. So, and also they triage your cases. If your symptoms are not very severe, you may not be given top priorities, but that's priority given to children and pregnant mothers and women. And if you have very severe symptoms, you are also brought in quickly and most likely referred to your NHS hospitals. Now, after seeing your GP, your problems are handleable by the GP surgery. You are treated, you are written, get your prescriptions, you go to your pharmacy, get your drugs, get better, get your antibiotics, whatever it is that you need, and you get better. However, if your symptoms persist, or if your GP sees the need for you to go further, they refer you to the hospital, which is the NHS, and then from there specialist doctors will see you and attend to your problem on a case-to-case basis. Alright, so that's it for the GP surgeries and the NHS. And also you have the community hospitals, where after you stay in the NHS hospitals, you can be sent to the community hospital instead of to your home, where you are continually cared for until you can be able to fit into your home, or you're sent to a rehabilitation center, or to a nursing home, or to a care home, or to a residential home, as the case may be. And when you're fit and healthy, you go back home. However, if you're not fit and healthy, you continue staying in the care home or the residential homes. That is the care of the elderly in this country. Now, working in the NHS or the care home. And like I said earlier, the NHS is the largest supplier and giver of health, provider of healthcare in the UK. Now, working in the NHS is like working in an acute setting. Now, it's like a standard hospital. You have every department, and NHSs differ in size, in expertise, and these are main departments and departments or specialties that they cater for. So some NHSs are quite larger than the others. NHSs that are teaching hospitals are quite larger than district hospitals or just ordinary NHS. By and large, they provide expert services. So in the NHS, I can give a comparison to UI, University Teaching Hospital Ibadan in Nigeria, or LUT, Lagos University Teaching Hospital in Nigeria. However, I'm comparing this in saying the specialties they provide, not like the standard. That's just the way to explain it. NHS are different in size and specialties. Just like you have bigger hospitals and smaller hospitals, the same thing happens in the NHS. Depending on the area of place they cover and the amount of people they cover, or how large the NHS trust is. The NHS is just an acute setting and can differ in quantity of people, specialty in which they serve, and the amount of people that they attend to. So you don't expect the same level of care or specialty in very small NHSs compared to larger ones, or compared to those that are found in the cities with large populations, if you understand what I mean. When you come to the care home, there is nothing I can compare a care home with in Nigeria, which is my main point of speaking. I'm sure in other countries they may have things that are similar, probably because their old population have places they can go to. But I know in Nigeria we don't have things like the care home in our health system. So in comparison to Nigeria and any other country that doesn't run a care home system, however, in the European Union, USA, Canada, most of these countries have opportunities for elderly population to be cared for when they cannot care for themselves in their homes, or when they have cases that are palliative in the sense I mean, that may end up leading to a death which is expected, probably because of illness or because of a disease condition, or most likely cancer or anything, or probably because of old age or incapability because of age. I know in Africa, in Nigeria, our elderly ones are cared for in their homes and in their families, are cared for at home by their families, by their children, and if most of them even stay in their houses and don't go anywhere. But for those who are lucky, their children take care of them till their death. But here, however, the system is different. Old people are also able to stay in their homes if they're able to take care of themselves independently. However, when they begin to have problems in taking care of themselves, they are usually assessed by the social workers, giving a care package that helps them to be able to carry out activities of daily living without problems. And when they cannot do it alone with these packages of care, which is either carers coming into their house once a day or twice a day or 3 times a day, they may end up going to a nursing home where people are there 24/7 to care for them, or going to a residential home where people are able to care for them 24/7 without any problems. So a care home is just a setting that looks like a house. It's just like a normal living condition. However, residents are able to get their medical needs sorted while in the care home. Unlike when they are at home, when they get sick, nobody's able to take care of them. Maybe they're not able to remember the timings of taking their drugs, or they begin to miss their doses, and then this begin to have adverse effects on them. However, in the care home setting, it is care given in an environment that is close to home. In the care home, when you visit a care home, it's just like you're walking into a big house. The environment is just like a house. You have the rooms with their closets and their clothes. Everything is all in their rooms. The only difference is that you have carers coming in who are there running the shift like basis and caring for them for their activities of daily living, of caring for themselves, washing, dressing, eating, feeding, moving them about if they need to, and making them more active, doing things that will keep them active and keep them involved. Okay, it's just a home setting. However, as a health professional in the care home, as a nurse in the care home, we are ensuring that these people have the right level of care, the right level of health. If you see them at risk of any health problems because of their health situations or because of their conditions, you raise a concern or you refer to the appropriate channels, or you invite their GPs to come and see them, or the specialist nurse or the practice nurse to come, and the specialist nurses who come to see these elderly ones in the care homes and provide the help that they need or give them remedies to solve their problems. You as a nurse in the care home, you're also there to ensure that the patient receives their drugs safely using the rights of drug administration. You are there to ensure that the residents do not get pressure sores from staying in one position. You're there to ensure that they are involved in activities that keep them alert and keeps them involved and keeps their mental status in a good state. We are there to ensure that residents are very fit and healthy. We are there to communicate to their families about the care that they are receiving, to tell them that, oh, your family is fine. In the event of anything, informing them and informing the right sources of what is happening. So a care home or a residential home is just care in a setting that is home-like. It's a home away from home, but the residents are getting the care that they need. So as a nurse there, you know your place in ensuring that these people are cared for and that you protect them, especially from any form of harm. You know they are old people and they are vulnerable in that they cannot help themselves. Some of them have learning disabilities, some of them have mental conditions that have affected them in old age, or they have become slow over the age or over the years, or through sicknesses. You know, some of them can have end stage illnesses. Okay, so basically you are there to ensure that everyone is fine and is as comfortable as possible and is kept safe as much as possible. In the acute setting, which is a hospital, you have the doctors. Now I'm going to tabulate the differences and probably this is going to make sense to you. Now in the NHS, you have doctors around, you have specialist doctors, you have nurses and specialist nurses around, you have dietitians, you have name it, rehabilitation officers, occupational therapists, physiotherapists, you have carers, healthcare assistants, you have nurses, you have matrons, just like in any acute setting, any other place in the world, depending on the level of specification and specialization that is found in any acute setting. However, in the care home, you do not have doctors, you do not have specialist nurses. You may have a specialist nurse who has retired and decided to take up a job, but in the care home, she's just going to be functioning as a nurse. She may bring in her specialist knowledge when it is needed. However, her responsibilities are limited in the care home. So in the care home, you don't have specialist nurses, you don't have doctors, you don't have physiotherapists, you don't have occupational therapists, you don't have dietitians. You are the nurse who's going to fit in that role. If you see a patient who has a need for that, you're the one who is going to take up actions to ensure that that patient gets the adequate nutrition that they need and they deserve. You don't have any physiotherapists. You as a nurse are the one who are going to be performing range of activity in motions together with the healthcare assistants, together with equipment that are there, like the agile or the standing aids or whatever. However, you have to have been certified to have done your moving and handling assessments yearly, so you can safely move the residents out and in of bed and be able to assist them in activities to help them to prevent muscle wasting. So all the specialties I mentioned in the acute settings are not found in the care homes. However, like I mentioned, the care home is a home-like setting where residents are able to get the care that they need, even in a setting that is close and feels like home. And like I said, your duty is to make them as comfortable as possible, keep them safe and away from harm, and protect them because they are a vulnerable group. Nobody should be deemed to be causing harm to anybody, even in the acute or in the care home settings. So basically, that's it about the difference between the care home. And like you all know, the workload in the NHS is different from the care home. You may have more in the care home because most of these patients are already stable, or the prognosis of their health status is already known, or because most of them are already known to have a particular diseases, or they have a particular prognosis which everybody knows what's going to be the outcome. However, whatever being the case, the difference are quite large, and like you know, this pay in the NHS is standard, whereas in the care home it can differ from employer to employer, okay, and probably from area of or the location of the care home, or the amount of residents you are expected to attend to. That's the basic difference between the NHS and the care home. The care home is just care in a home setting with residents who are usually above 65 and elderly people, whereas in the NHS it's an acute setting that caters for all ages, from childhood to adulthood and to old age, for a short period of time until they're able to be transferred to either their homes or their discharged home, or sent to the care home, or wherever the outcome of their hospital admissions determines. I hope I've been able to answer or address this question. If you have any questions, do ask in the comment below. I'll do my best to answer. Don't forget to like, subscribe, and I'll see you all in my next video. Thank you for watching. Bye.